During today's session, what I'd like to do is take you through the importance of using the PAR-Q form and ensuring that we get the PAR-Q form filled in correctly. Now, a pre-activity questionnaire form, a PAR-Q form, a screening form, or medical history form is the only form that actually stands in between someone successfully suing you and you protecting yourself as a personal trainer. So this is a really important form and something that needs to be filled in by the client to the best knowledge with full amount of detail as possible. So when we look at the history form, we start off here with what I call critical data. Critical data is their name, their address, their date of birth, what they do for a living, and their contact details. You also do want to have an emergency contact in case anything was to happen and you would have to give someone's details to the police after an emergency situation. You do also want to ask for their birth date, so then that way you can remember to do a birthday SMS and a birthday card for them, and you also want their address so that you can mail them Christmas cards and birthday cards. So this information here is really important and should really be collected when the person first inquires so that you know how to contact them. The second part of the form starts to move into more medical history and medical details. This tick box here is a really easy way to cover a wide range of medical conditions. So we would get the person to circle any medical conditions which they've either got or they've had in the past. So if a person had glandular fever when they were 16, you would get them to circle that and you would then actually write when they were 16. If somebody had bone abnormalities such as they'd had a lot of pain in their knees or their legs when they were growing up, potentially you'd write that down, but you'd also make a note to whether these conditions still affect them now. If somebody, for example, gets dizziness and fainting because they have low blood pressure, then when you circle dizziness and fainting, I would draw a line up here saying related to low blood pressure. Then here I'd write their blood pressure and potentially write what their blood pressure normally is. If someone has diabetes, I would want to know is it type 1 or type 2. If somebody has asthma, I'd want to know what causes the asthma, what makes their asthma worse, and are they on a puffer or a preventative, and is it controlled? So you should get the gist here that we really want as much information as possible. When we look here, are you on any medication? We want to know about all medication, whether it's natural or whether it's prescription based. You know, if a client's on the pill, that could be affecting their blood pressure. If they're on depression medication, if they're on blood pressure medication. Now, sometimes when someone writes down medication, you won't know what that's for. So you need to ask the client, what is that for? Don't pretend that you know what it's for. Now, if they don't tell you what it's for and you don't ask, you need to go and research that and find out. What you should do is when someone is on medication is you should go back and have a look at that medication and the side effects of that medication and see if exercise impacts that medication or if that medication impacts weight loss or muscle atrophy or any other medical problems that could be related to the results that they're wanting to get. Have they been hospitalized in the last 12 months? Again, if they put yes, you want to know what for, why, is this causing any problems for them in their life? Does this prevent them from doing any exercise? Does this actually cause any pain? Joint pains. Now, joint injuries. Joint injuries relates to any sort of pain or injury related to a joint. So this could be related to arthritis, it could be related to a bulged disc, it could be related to a joint injury. If the person writes down back pain, then here you want to know where in the back. What region is it in the back? So lower lumbar region, upper thoracic region. If they write down they've had frozen shoulder, you want to know which shoulder. Is it the left shoulder? Is it the right shoulder? When did they have that pain? How long ago was it? Have they seen someone to get it fixed? And does that injury or that joint prevent any movement from occurring? So if someone has knee pain, they may not be able to do jumping because they've had an old knee injury. That would be something you need to write down on here. The same philosophy needs to sit with soft tissue injuries. With soft tissue injuries, you need to ensure that you are putting down, if the person's had a torn hamstring, it's on the left-hand side, the tear occurred in January 2014, that was a mild tear, they saw a physio and received rehabilitation, and now it's constantly tight and constantly causing pulling, however, it does not stop them from doing any activity. That's the level of detail you need to be looking at. You also need to be asked, are there any other medical conditions? Now, a lot of the time, what I will see people do is they'll just put a dash, a dash, a dash, a dash. We actually want them to write no, not on any medication. No, no. So then that way, if you are presenting this form in court, each question is answered. Remember, this is a legal document and needs to be filled out fully. When we get down into this section here, we want an outline of their medical history. What have they done in the past? Have they done personal training? If so, how many times a week did they train? What sort of exercises did they do? Did they get results? Were they happy with the training? What exercises did they like or not like? When we look at talking about their goals, we want to know specific goals. So if someone wants to lose weight, what does that mean? How much weight do they want to lose? Do they have a specific goal weight that they're wanting to achieve? If someone wants to tone up, where do they want to tone up? And what does tone up mean to them? Does that mean that they want to look like Arnold Schwarzenegger, or that they just want to have a firm body? You see, everybody's definition of fitness, weight loss and toning is different. So when you're dealing with your client and you're trying to help them set their goals, you need to understand what they mean by this. Every goal needs to be have a SMARTY goal. It needs to be specific. It needs to be measurable. It needs to be realistic. It has to have a date attached to it. It needs to inspire the person to want to do it and have an emotional attachment. So you need to ask these questions about their goals. Why do they want to achieve that goal, and how would they feel when they achieved it? So if their goal was to get into a pair of size 8 jeans, what would that mean to them, and how does that make them feel? Imagine that you're in your jeans. How would that make you feel? On the next page here, I use these particular scales for people because I want to focus more on feeling good and on emotions. So I ask them on a scale of 1 to 10 where they base their energy, and most people might start down here, and then in 10 weeks time you would get them to fill out a new form and you can show them how much they've improved. Again, you'd ask them on their fitness levels where they sit here, and again you can see the improvement as it goes. You can do measurements. We will tend to take these measurements. That is all. We don't tend to do a lot of other measurements unless the clients specifically ask for these measurements. You know, the other formula that we use is we use a bio-age assessment where we calculate how old the client is based on their lifestyle and their health, which is something we can go over more in certificate 4. You have to have a privacy statement waiver, and you have to have a waiver that states that the person's given you all their health information and it's true and accurate, and that there's nothing that they haven't told you about, and any information that they haven't told you about you cannot be held responsible for. So the client needs to have read this, they need to sign it and date it, and you must witness this as the trainer. If you don't witness this form will not stand up in court as evidence, and you won't be able to utilise it to prove that you took a duty of care. Now, these forms are all about assessing risk, and in the PowerPoint presentation on pre-screening, we'll talk about different levels of risk in relation to clients and making sure that you are actually assessing the risk that your clients could get injury, because it's your responsibility as a personal trainer to take a duty of care to make sure that you're looking after your clients and you're doing everything humanly possible to ensure that they do not injure themselves. Please feel free to use these statements in your own business and within your own gym, and also if you want to have a copy of this form, it is available for you online, and I have no problems with you taking this form and utilizing this within your own facility, health club or studio. We hope this helps you get a little bit of information on how we want you to do pre-screening. In your assessment, you will be required to video yourself taking someone through a pre-screening form, and what we've just gone over there is how we expect you to fill in the form and the sorts of questions you need to ask. I would suggest get the client to fill into here and then take the form back and you fill in the rest so you can ask the questions as you go. Because if you leave the client to fill in the form, they just won't fill it in with the level of details that you want. Another type of form that you can use is a form that's actually produced by Fitness Australia. This is a pre-screening tool that Fitness Australia has produced, and as you can see, lives online at this address. There are a number of questions on here for the person to go through, and what this does is it gives you more detailed analysis on whether or not you need to actually refer them to an allied health professional or not. So this is a form that you can utilise that's endorsed by Fitness Australia and Sports Medicine Australia, and it's a good one to have around as a gym instructor or in a gym. From here, what it also does is it also then suggests what you should do with the client depending on where they're at. They have a second form here which is a little bit more detailed. This is probably more effective for what I would probably want to be suggesting you use. You'd pop in their details here, their critical details, all this information here. Okay, questions about history, whether they smoke, what sort of exercise they're doing, their height and their weight to calculate their BMI, their blood pressure, cholesterol, whether they've been in hospital, taking medication, pregnancy, muscle or joint pain. Okay, and what this does is it actually suggests what risk factors are. So if a male's over 45, then that becomes a risk factor. If a male's over 55, then again that becomes a risk factor here. Okay, if the person smokes, that equals a risk factor, and that allows you to determine how many risk factors the person has, which then allows you to determine if you should refer this person to an allied health professional before starting exercise. So down here, as we move on, then you could take people through these sorts of assessments, looking at their BMI, their girth measurements, their blood pressure. If you want to refer them to a doctor for different types of testing and blood tests, you can do that there. And then you get more risk factors. You can see here a total of two or greater risk factors, individual at a moderate risk and may participate in aerobic activity at the light level. Less than 2 risk factors, low risk client, and hence they can participate in aerobic activity that is up to a vigorous or high intensity. The great thing about this form is it protects you because it's produced and endorsed by Fitness Australia and by the Exercise Science Australia and Sports Medicine Australia. If you follow this particular form here with your risk factors and then say that you actually develop a program that matches these two outcomes, then obviously you're a lot better at protecting yourself in court if someone were to sue you. So this is another option of a form of which you can use. Of course, if you have any questions, please feel free to email us and we'll be more than happy to help. We'll talk to you soon. Thanks a lot.